So I have 2 o'clock, so we're going to begin now, okay? So hello everyone on the phone lines and welcome to part 1, how to perform an oral assessment in long-term care, the normal mouth. So all the phone lines have been muted and we'll be able to ask questions at the end of the session. You can either do this by typing it into the Q&A box or by asking over the phone. Okay. So we're using WebEx for today's presentation, so just a few features we'd like to highlight. So in order to be able to expand to the full screen mode, so you can see the entire presentation, just click on the full screen icon in the bottom left-hand corner. So during the presentation, you can ask questions throughout on the Q&A panel or the question and answers, and Heather will be monitoring this throughout. So if you have any technical difficulties or anything, please type it in here. So I'll introduce myself. I'm Ebo McDonald, the Long-Term Care Best Practice Coordinator working in the Champlain LHIN. And here with me today is Tanya Peachman-Faust, who is a dental hygienist. She's a GPA certified coach. She's a faculty member in the dental hygiene program at Algonquin College. And she has her own mobile dental clinic business that specializes in providing services to residents in long-term care. So her wealth of knowledge and expertise is really greatly appreciated. Welcome, Tanya.
Thank you. Thanks for having me.
I'd also just like to note that her students this year did help to upgrade this presentation. They helped to make this presentation last term and they've upgraded it based on feedback. So there are sections that have been pre-recorded by the students. So the Best Practices of Oral Assessment series has 3 parts. It was designed so that each part builds on the previous session. There's just too much information to cover at once. If we put all of this stuff in together, it would have been an hour-long presentation, and we realized that time is of an essence for you, so we didn't want it to be that long. So I know that there'll be times when you're thinking, oh, I want to know more on abnormal changes, or I want to know more on interventions. That is coming. It'll be in the other sessions. So today we're going to cover and talk about the normal mouth. Then part 2 is on common abnormalities and unhealthy changes that you see. And the final one will discuss nursing interventions that you can do in your home, as well as understanding when referrals are required. The objectives for the presentation today are to demonstrate an approach in assessing the oral health status and cavity of residents, and to illustrate normal changes associated with aging in the various areas of the mouth. So oral health is an indicator of a resident's overall health and well-being. The goals of oral care are to improve the resident's comfort and maximize their quality of life, to ensure that the risks of oral problems and infections are decreased while managing any associated pain, and finally, maintaining resident dignity, privacy, and control are also important. So in order to ensure that oral health needs of residents are met, there needs to be a thorough assessment of oral hygiene beliefs and practices on admission. The assessment should also include inspecting the current oral health status of the resident. So by assessing their beliefs and practices and their oral health status, a thorough care plan can be developed that meets the resident's needs, along with being able to implement appropriate interventions. When assessing a resident's mouth, use an organized and consistent approach. The use of a standardized assessment tool can help you to do this, as it helps with sequencing, and it can help to cue you as to what you're looking for in each of the parts of the mouth. So the purpose of doing an oral health assessment on admission quarterly and with change in condition is to monitor and evaluate oral health by ensuring that effective oral hygiene is being done, and it provides a means of monitoring the effectiveness of interventions. So all of these bullets relate back to the practice recommendations in the Oral Health Best Practice Guideline number 2 and 3. So in Ontario, all long-term care homes are required to complete the RIMDS assessment. So when it comes to oral health, Section L is really the main part that does this. But you can, although RIMDS is the required reporting, it's really just the minimum assessment that's required. So there are other sections that could also be considered, so such as Section K, so resists care. So is the resident resisting any care during oral care? As long as weight loss, as this can affect the fit of dentures. So what this slide is showing is an overview of the various standardized oral health assessment tools that are validated for use in long-term care. And just a little side note that these tools have, for the most part, been validated in just small sample sizes, but they have been validated in long-term care. So the assessment tools are down the left-hand column, which include the RIMDS, the OHAT, the throat, and the brief oral health status exam. And across the top are the components of the oral cavity that should be assessed. As you can see, there is no one assessment tool that's perfect and that captures all the components. However, capturing as many of the oral cavity components in a consistent manner is the goal, as it would help track residents' oral health over time. So it's important to note that the RIMDS tool alone is not broad enough to capture all the areas of the mouth. So the purpose of using an assessment tool is to provide written documentation of a resident's oral health status, and it makes it easier to identify normal and abnormal changes and track and compare it over time. So this is an example of the Oral Health Assessment Tool, or the OHAT. The purpose of today's presentation is to discuss what you're looking at when you're looking in the resident's mouth, and in particular, that column as healthy. So what categories are there and what makes it healthy? And then the next two sessions will build upon this.
When doing the oral health assessment, the required equipment that you will need are gloves and a mask, a tongue depressor to help control the tongue, gauze, which will also help hold the tongue, and it may be used to remove debris as well, and a light source. Optional equipment that you can use are handheld disposable oral mirror, which helps effectively examine tissues and teeth at the back of the mouth, and also a headlamp would be useful. During the exam, you should first introduce yourself, explain what you're going to do, get the resident's consent for the exam, and seek feedback continuously with the client. Monitor for body language, visual and verbal cues, and stop if the resident is no longer cooperative.
So we just have a little video here to show you.
Looking at the lips. Could you take your desk chair for me? Okay. Looking at the cheeks. Making sure to retract the cheeks back to look in all areas. Looking at the roof of the mouth, feeling it for any lumps and bumps, and also taking a look for any difference. At the tongue, both on the top, underneath the tongue.
Other things you should be noting. Smell. Is there any smell in the breath? Could be a lack of oral cleanliness. Saliva. Does your gloved finger stick to the insides of the oral tissue? Means there's not enough. And finally, are there any complaints or physical signs of pain? Okay.
When you are about to perform an oral assessment, you will want to have all your tools ready. You'll want to start evaluating in the areas that are least invasive, leaving the most invasive to the very end. Begin with observing the lips. Insert then your fingers into the corners of the lips and gently pull them out and back so you can view the gums, the teeth, and the level of debris present in the mouth. Debris may be coating the teeth or the gum tissue. You will then want to run the pad of your finger with very slight pressure along the gums and the teeth to assess for any mobile teeth or any signs of pain. Now you will look at the insides of the cheeks, examining them one at a time. Gently pull back one cheek and then the other. Ask the resident to open their mouth wide. Examine the inner surfaces of their teeth, the top of the tongue, and the roof of the mouth. Finally, we will examine the area which elicits the most resistance. Inspect the sides and the underside of the tongue by using a mirror or a tongue depressor. You may also want to palpate or feel these areas under the tongue and along the side of the bone with your finger to feel for any masses. This is an area where oral cancer is most commonly found.
Next, the lips must be examined. The normal aging process results in the loss of fatty lip tissue, causing thinner lips and more wrinkles. At rest, lips should be touching, protecting the oral tissues from drying out. The lips themselves may appear either moist, somewhat dry, or cracked. Dry, cracked lips are often seen during the colder, drier months. Close attention must be paid to any lesion that presents on the lips. Some lesions that are normally seen in an elderly person include freckles or sunspots that appear as dark macules or vascular lesions caused by dilated blood vessels. The bottom picture is a good example of a varicosity likely resulting from many years of smoking, found exactly where the cigarette was or is placed time and time again. Varicosities may also result from many years of sun exposure. The picture above is a good example of what a freckle on a lip may look like. Although some lesions are normal, all must be examined for any changes in appearance. Now we're going to look at the tongue. Though many normal and healthy variations can be seen underneath the tongue, typically on the top of the tongue, we're looking to see a pink, non-coated tongue with uniform appearance across the tongue. The following photos are pictures of variations of normal that we may see on the tongue. The first and most common variation of normal would be the coated tongue. The coated tongue results of a buildup of debris, bacteria, and dead cells accumulating between the taste buds on the tongue. It would be helpful to add a tongue cleaner at least once a day to help reduce this buildup on a client. Even the brushing of it with a toothbrush would work. Second, in the middle picture, is a geographic tongue. This presents as red, patchy areas with white borders. The presence can be exacerbated with stress and can be accompanied by complaints of burning feelings. Avoiding acidic or sugary foods and liquids can help reduce the sensation. Lastly, we see a fissure tongue. This presents as deep fissures or grooves on the top of the tongue. Often, clients experience the same burning sensation as geographic tongue, and it is recommended that the client brush their tongue lightly with a toothbrush to remove any debris. This is also a common finding with clients that have or complain of dry mouth due to either medication or some other condition. Now we're going to examine the oral tissues. The photo on the left is a picture of what we would consider a normal oral tissue. As you can see, the tissues are pink and moist. In the middle, we see our first abnormal tissue. It is called tissue trauma. It can be caused from either biting or food particles that may cut the inside of the cheek. In the top right-hand corner, we see what is referred to as linea alba. It is a thin white line that can be seen inside one or both of the cheeks. This is usually due to cheek biting or clenching of the teeth. In the bottom right-hand side, we see a canker sore. Your diet, biting, and genetic predispositions are some of the common causes of canker sores. Be sure to note any lesion that lasts more than 2 weeks must be looked at by a physician or a dentist. Next, we're going to take a look at the gums, also referred to as the gingiva. The following are some normal age-related changes that we may see. Ideally, we want the gums to be pink, firm, and moist. Red, swollen gums are an indication of disease. Ideally, the gum tissue between the teeth, referred to as the interdental papilla, should be pointed. Over time and as we age, this pointed papilla becomes cratered or blunted, as seen in the photos in the top right-hand corner, as well as the bottom right-hand corner. Another variation of normal that we may witness is pigmentation of the tissue. Now we're going to take a look at the saliva. Saliva is a very important substance that helps defend all oral tissues against disease and destruction. It is for this reason that an assessment of the quality and amount of the saliva present in the person's mouth is essential in determining one's oral health. The ideal finding is a medium to abundant amount of watery saliva. When completing an assessment, the assessor must know the presence and amount of saliva being light, medium, or abundant, as well as the consistency of the saliva on a continuum from watery to thick. Some healthy mouths may show signs of thick or light to medium amounts of saliva. As long as all the tissues may appear moist, saliva substitutes may not be necessary. Now we're going to take a look at the teeth. The following are some normal age-related changes that we may witness between different individuals. Generally, teeth are even in color. They may present in different shades of white or yellow. We also may see some staining. Recession or seeing exposed root surfaces. Missing teeth or no teeth. Teeth may be straight, appear crowded, tilted, or rotated. Heavily restored teeth, for example, teeth with metal fillings. And we might also see some signs of wear, which is referred to as attrition. In a mouth with metal fillings, it is common to see a tooth and the surrounding tissue take on a blue color. This is normal and is nothing to be concerned about. Although attrition is common, severe attrition may cause people's teeth to become very sensitive to hot and cold, as well as chewing sticky foods, as there is very little dental material covering the nerves. The following pictures demonstrate some of the findings we just discussed. In the top left-hand corner, we can see some examples of recession. As you can see, the gum line has receded downwards. In the top right-hand corner, we can see a picture of what metal restorations may look like. In the bottom left-hand corner is attrition. As we can see, the teeth have worn down, and this causes teeth to become very sensitive. And in the bottom right-hand corner, we can see a general discoloration of teeth, all becoming a generalized yellow color. Plaque is a form of debris commonly seen in the mouth. It can be on all oral tissues in the mouth and can be wiped off or brushed off with normal daily oral hygiene. Large amounts of plaque is commonly seen in the elderly because of a lack of daily oral hygiene, medications, or manual dexterity issues, and they cannot do it on their own. Food debris is stuck between the teeth in the mouth. It can also be brushed off with daily oral care. Calculus, a more tenacious form of plaque, requires regular dental visits to be removed. If plaque is not removed, it could result in calculus.
Assessing the dentures is an important step in oral assessment. Their function and cleanliness affects not only their oral health, but their overall health and wellness. The dentures should appear smooth, with no staining or patchy areas of debris. In the lower image, you can see that there are patches of white, which is actually debris on the denture. In a healthy denture, this should not appear. The denture should be clearly labeled. You want to check the edges of the denture for rough areas. The edges should actually be very smooth to the finger. There should be no areas of worn acrylic, and there should be no chipped or broken teeth. With your pointer fingers, you will want to assess the fit of the denture. Place your pointer fingers on each side of the denture, right and left, and apply a slight pressure to try to rock the denture side to side or to the front and back. It should be stable and the denture should not move to be considered a healthy fit. Taking into consideration the level of debris, the overall denture itself, and the fit, you would then be able to determine the status of the denture. Odor is an important indicator of oral disease, infection, and high levels of debris. Always keep your nose on alert for changes in the mouth. I've experienced residents with malodor who, once they've had their teeth cleaned or their mouth brushed, the malodor goes away and the healing occurs. Constant assessment for pain is needed. That being said, not all resistive behavior is a result of pain, but could be an indication that more investigation is required. Watch for verbal complaints or physical signs such as tensing of the muscles or flinching during assessment or oral care.
So completing a detailed and accurate assessment is necessary for developing a plan for daily oral hygiene and care, as well as for evaluating oral hygiene interventions. By being able to quickly identify problems, this ensures timely treatment and referral. So here's an example of a completed OHAT. So I've gone ahead and put it in for mostly the normal, but as you can see, we did discuss, so under tongue, fissured could be something that you could see. It's not necessarily always something that is bad. It's something that you do see, but it does need to be noted. And I also said that there was no name on the dentures. It's really important to look for that on dentures because depending on the method you use, so if you use the one where you're writing on with a little pencil and applying the lacquer, it doesn't last very long. So you do need to monitor and ensure that that label is there.
Now we're going to talk about some challenges you may come across while completing an oral exam or an oral assessment. The most common challenge that we may see are residents are reluctant to participate and won't open their mouth. Try stroking their cheek and their lips, talking in a very calm and patient manner, asking them to please open. Next, you want to prioritize. You have to do as much as you possibly can. Focus on what the RAI-MDS Section L includes. Debris present in the mouth prior to going to bed at night. Have the dentures been removed? Some or all natural teeth lost. Does not have or does not use dentures or partial plates. Are there broken, loose, or carious teeth, which are teeth showing decay? And inflamed or swollen gums or bleeding gums, oral abscesses, ulcers, or rashes.
Oral care is one of the basic personal care requirements. However, it needs to be carried out consistently. If not, oral disease such as gum disease and cavities will occur and results in poor oral health. This slide outlines the basic oral care techniques that are required and recommended for all residents. Oral care should be done at least twice daily, using a soft toothbrush with only a pea-sized amount of toothpaste. Brush for the recommended 2 minutes and ensure that you brush all surfaces of the teeth, the outside surfaces, inside surfaces, and the biting surfaces. After providing oral care, please ensure that the mouth is left moist, including the lips. Encourage your resident to stay hydrated. Saliva substitutes are highly recommended. Consider resident preferences and abilities in cooperating with their own personal care, and use different techniques such as bridging, mirroring, two-toothbrush technique, and two-person technique to ensure proper oral hygiene. These techniques are going to be further discussed in future sessions. Any oral care provided to residents will fail in the long run if adequate regular oral care is not provided.
So this is just a reminder that the next 2 parts of the assessment series are on November 25th and January 13th. They're both as well from 2 to 2:30, and the registration links are provided here. And I do want to acknowledge that I did see that there was quite a bit of issues with volume, and we'll make sure that we do take care of that next time. Sorry about that. So here are just some resources quickly. So we recently launched our new long-term care toolkit. So please go look there and look at the oral care section. There's some really great resources. There's the best practice guideline available as well if you're interested or if you are in the process of looking at implementing oral care. And then there's 2-3 videos here, YouTube videos on oral health assessment, just to provide you a different perspective. So I just wanted to acknowledge this very lengthy slide. Really it just says that Tanya's students helped to develop this, and that this year I wanted to acknowledge Brittany, Caleb, Stacy, Sinam, Preet, Hawa, and then Natalina for their help with revising this presentation based on feedback. So this takes us to the end. I hope that you've been able to learn some new beginning skills on oral assessment, and that you will join us in 2 weeks for part 2. We will take questions at this time. So again, I'm going to unmute the phone lines for questions, or you can type it into the Q&A box as well. Unmute 99. So are there any questions? Anything, Tanya, that you thought of? No. Well, thank you, everybody. We'll stay on for just a little bit in case there are any questions. And please do complete the evaluation. There's a poll that I put up if you haven't done so already. think it looks like there are no questions, so I'm going to stop recording for now and thank everybody for attending, and I really do hope that you've learned a little bit about oral assessment. And thank you, Tanya.
You're welcome.